So my name is Dr. Shelly Russell-Mayhew. I'm an associate professor in the Werklund School of Education, and I received my Bachelor's of Science in Psychology at the U of C and my Master's of Science and my PhD in Counseling Psychology at the U of C. I study things like eating disorders and obesity and body image and weight bias. Really anything that has to do with weight or eating is an interest of mine. My passion really is in the health promotion, prevention end of that, because I really like to look at how can we influence children and youth to grow up in a way where they feel they have a positive, embodied kind of experience rather than unhealthy experience. So I do focus more on the prevention end of the continuum of care. I'm also interested though in treatment and do some work with health services as well. So one of the things I do in my research is I try to influence people who are adults in children's lives. And one of the very important sets of people that do influence children are teachers. And so at the Werklund School of Education, we've come up with what we've called the Health Champions Program. And today was the second day of a 2-day conference where we're doing professional development with Bachelor of Education students from our program. One of the things that we want teachers to be able to do is to infuse health activities across the curriculums. Like no matter what they're teaching, we want to encourage teachers and give them the resources and the expertise that they would need to be energizing to their students, because we know that healthy students make better learners. Really what I'm after is how can we create an environment and a context where no matter where a child and youth may go, whether that's school or the doctor's office or at their coaches or with their parents, that they receive the same kind of healthy messages about their body and their relationship with their body, no matter who they're talking to or no matter where they go. So really my research program centers on how can we change the societal discourses, how can we look at the kind of influences that the world is having with children in relation to their bodies, and how can we change that so that the majority of children are growing up feeling empowered and are using their bodies in ways that are for positive change in the world.